Are you hoping to avoid neck or back surgery? We know that millions of people suffer with chronic neck and back pain every year. 2020, though, this can be a pain-free year with a little help. Our expert in relieving that kind of pain joins us now, Dr. Christopher Miller, with one of his patients. Joyce, welcome to 8 West and Happy New Year.
Happy New Year, Terry.
So a lot of us, you know, the holidays are a busy time. This is the snow and ice season. A lot of people really can start having those back and neck pain issues really aggravated.
Yeah, a lot of these activities are new because it's just the holiday season, and it could be just, you know, family events. It could be, you know, with your coworkers, or, you know, there's just a lot of new things going on, not necessarily used to doing. And it's a time a lot of people realize they're not in as good a shape as they thought they would be. And it makes it difficult to get around, to walk any length of time. Some of them, it's just tough getting up in the morning, where it might take several hours to get loosened up enough they can start functioning for the day. And a lot of things we take for granted, Terry, can be difficult too, just like getting socks and shoes on and off because their back pain is so severe. It's a challenge for them.
And you know, for some people, it just could become one of those issues where they've put off so long taking care of themselves that they've just learned sort of either to mask the pain or just put up with it. But a brand new year, a brand new you could be the resolution, right?
Yeah, I mean, New Year's is a time a lot of people want to commit, make some changes, and so we would encourage those people, you know, even if they've been told that they have to get neck or back surgery, it may or may not be the case, but I do want them to know there are other options. And, you know, if they really want to work on fixing the cause of it, many times surgery isn't doing that either. A lot of those treatments just mask the pain or cut things away to create more space for the nerves.
Okay, so let's talk about it. We have a graphic that shows someone who has had surgery.
So this is a spinal fusion. So when people talk about getting their backs fused, this is many times what it would look like, but it's a very invasive procedure, Terry. They're cutting away bone to create more space for the nerves. Those are actually rods with large screws that they bolt into the spine, but you know, those areas will never move again. So it leads to a lot of restrictions in mobility and movement. And the other thing is every level of the spine takes on a certain amount of stress. And so if you start fusing these areas together, the stress is going to be pushed elsewhere in the spine, usually around the fusion. Then those areas wear down quickly and can become a problem just months or even years down the road.
Right, you could be having additional issues. Joyce, you started seeing Dr. Miller this past fall. Exactly what was going on with you?
I was having a lot of lower back pain, lower burning and numbness in my right leg. And because of that, I was looking for other things to try to help my pain. I was getting adjustments from another doctor and massages, but nothing was working. I was using pain patches, Tylenol, you name it. I was using trying to relieve the pain.
Relieve the pain.
And I saw Dr. Miller on TVA. And I was like, oh my God, I was at work and I was hurting then. I was like, oh my God, I'm gonna call that, I'm gonna call that number. And so I did, and I've been much better, greatly relieved since I started my treatments.
How quickly did you start to feel relief from the pain?
I started feeling my relief about two treatments in.
Okay, yeah, so pretty quickly.
Very much
you really
so,
started to feel that. So let's talk about on the models here. What was Joyce, what was going on with Joyce?
Yeah, so we don't just throw patients on the machine or start treatments. We want to make sure we know what the cause of their pain was. So after Joyce and I met, we did a thorough exam and took some x-rays, and unfortunately what we found is that she did have degenerative disc disease, where these pads, where the discs in her lower back were drying out and thinning down. And because of that, that started to put pressure on her nerve and cause that pain in the back and numbness in her leg. That's not really a condition adjustments are going to help with. That's more about misalignments. So knowing that she had the degenerative disc disease, that's one of the main conditions that our spinal decompression program treats. And just after we talked and, you know, diagnosed that, you know, I found she was a great candidate for this. And
yeah, so let's see the video. I think this video really does a great job in showing exactly what's happening when someone's utilizing the decompression.
So it's non-invasive but very specific, and with computers it gently stretches that degenerated area of the spine and reverses a lot of those conditions, Terry. So when they're degenerated, the discs start to rehydrate and thicken up. If they have bulges or herniations, those are drawn and retracted away from the nerves back where they ought to be. So, you know, our patients really get great results because we're actually fixing the cause of their pain. We're not just masking it, which is what what so many treatment options are about.
Yeah, so you have a variety of different kinds of specific symptoms that you are able to treat with this.
Yeah, it's a lot of those chronic issues of the spine, degenerative disc disease, herniated or bulging discs. A lot of patients have been told they have spinal stenosis or arthritis in their back. And then like Joyce, the sciatica into the leg. But it's these degenerative issues that it helps with. And like I said, it's non-invasive, so they don't have to worry about the drug shots or surgery. And I think for most patients, you know, once they get on there, it's relatively comfortable. And many of them just take a nap during the treatment. It feels good to them.
Yeah, that must have been good for you. How was it going through the treatment program?
Going through the treatment program was very comfortable. The Dr. Miller's assistance was very, very, very informative of what was going on and what was going to happen and how long it was going to take, and tried to make me comfortable in every way possible. So that was a great experience, and it was good to know that they was always there checking on me, making sure that I was, you know, safe and comfortable, and turning down the music, turning up music. It was nice.
And you have a special for 8 West viewers.
We do, Terry. For the new year, if they call our office today, we do a consultation and the examination for $20.20 to celebrate the new year. They can call our office to schedule that, or they can go online at thchiro.com to schedule that as well.
Fantastic. Yeah, thanks so much. And Joyce, I'm glad you've gotten some relief. Glad you're watching 8 West.
I am watching 8 West, yes.
And stay right there. More of 8 West when we come back. Don't go away.
Thank you.